So I can do anything from ladies smear testing, children's immunisations, travel jabs. I do a lot of leg ulcer work. I'm also the diabetes specialist nurse here, so I do a lot of chronic disease management as well. Very varied.
I like the variety. I like working in a team. There are some general practices where you can work on your own if that's what you prefer. Small village practices.
I'll be seeing patients for long-term condition reviews mainly, so that's diabetes, COPD, asthma as well. I'll see them. Also see little babies for their immunisations, toddlers. I love seeing toddlers for their immunisations, they're great. See ladies for their smears, all sorts of things really, yeah. And if anything can come in, it's always a surprise what's going to happen next.
I think that there's going to be less and less of the hospital secondary care facilities, and so if we can prevent people from being ill in the first place or support them when they first get diseases, then hopefully they won't have to use the secondary care facilities in the same way.
I think it's got a lot to offer as opposed to working in a hospital. You can be far more autonomous, you have your own patients to look after, you have your own clinic list to work through during the day. And I think a lot of people a lot of nurses don't know what it's like to work in general practice because they don't have the opportunity to have placements.
The job was offered, I applied, didn't think I'd get it because I thought I was too young. I only had 3 years experience on the wards when I applied for this, and they were really happy. Yep, absolutely, come on in.
It's flexible with hours. It's also got a good sort of work-family life.
I think because I've been nursing for a long, long time, this particular role as a practice nurse has been, it's allowed me to use all of my experience from before and bring that to the practice.
The best thing is being able to make change. We're right at the front of, health promotion, and I feel that, we can get the patient in the centre of the care and give them individual care tailored to them and their family's needs.
If you're working on a ward like I was, you get the patient in front of you, you do the obs, you do what needs to be done, and that's it. You probably don't see them again. They're off into the system. Here, I know 80% of my patients, I see them regularly. I know their families, they know my family. It's just a nicer way to work.
You do see lots of different people at lots of different times in their lives, from giving them an injection when they're pregnant and then seeing the baby when it arrives and knowing who the grandparents are and all that sort of thing. So it's proper family practice.
There is a practice nurse qualification that you can do at university. I, however, did the old-fashioned way of just coming into practice nursing and just doing each module as I went along. So,
I'm a registered general nurse. There is a qualification required to be a practice nurse, which what we call the graduate practice nurse course, which I didn't have before joining. And I'm luckily given a chance to do the course. So, I did the course for 6 months, and after passing the course, I'm full-on practice nurse.
I think it's definitely a lot more individualised. You can focus on yourself and your needs and your learning outcomes rather than the generalist, what the hospital needs you to do.
Some practice nurses will develop to be advanced nurse practitioners or advanced clinical practitioners.
In this area there's a very good nurses forum, and the education department is excellent, and we get regular courses we can go on that are free.
And massive opportunities in practice nursing. Obviously you come in as a practice nurse and you're a treatment nurse, but also you've got the opportunity to do chronic disease, so you've got your diabetes, COPD and asthma nurse. You also got management, there's even teaching that you can use those qualifications to go into as well.
If you develop an interest, you can become a specialist in it really, and you can go on and become a nurse practitioner or a prescriber. So where people used to think it was a bit of a dead end, it isn't anymore. It's got great potential.
What I want to do is to encourage younger nurses to come into practice nursing So if anybody ever suggests that they might want to do it, then I'm all for asking them to come in and experience it.